Hi, everyone. Thanks for joining me for this quarter's legislative update. In the wake of the COVID-19 pandemic, it's been interesting to see what temporary or emergency legislation enacted therein has survived. Countless laws on both the federal and state levels were enacted on an emergency or temporary basis in order to address the unique challenges presented by the pandemic. Nowhere more often than in the realm of healthcare, certainly. And now that we're slowly coming out of the pandemic, many states and the federal government are considering which of these laws make sense to extend or implement more fully or make permanent. One example of these initiatives involves licensees who played critical roles throughout the pandemic, pharmacists. In order for communities to be adequately served during the pandemic, numerous states broadened their definitions of a pharmacist's scope of practice, front and center being the ability to administer COVID vaccines. And in fact, pharmacists administered more COVID vaccines than any other one particular group of healthcare professionals. And as these changes were happening, the federal government made adjustments in law in order to protect pharmacists and other healthcare providers who were providing services that they weren't formally authorized to provide. Now, for example, the Public Readiness and Emergency Preparedness Act allowed for the Secretary of the Department of Health and Human Services to issue a declaration related to COVID tests, COVID drugs, and COVID vaccines, and providing liability protections to healthcare professionals, among others, who administer countermeasures to the illness. The declaration's been amended numerous times throughout the pandemic to expand liability protections, including to cover pharmacists. And what this means is that, except in cases of willful misconduct, a pharmacist, for example, is immune from lawsuits under both federal and state law for any injury resulting from the administration of the COVID-19 vaccine, so long as they meet the criteria under the current declaration as it stands. There's also a proposed bill making its way through the House right now called the Equitable Community Access to Pharmacist Services Act. It was introduced in March, and it would add pharmacists as eligible providers for Medicare Part B beneficiaries of pharmacy and pharmacist services related to the COVID-19 pandemic and other specified infectious diseases. This also establishes a federal reimbursement mechanism for pharmacist services for those Medicare Part B beneficiaries. The bill is currently being considered by the House Subcommittee for Health and reportedly has some broad bipartisan support, so we may see it acted upon sooner rather than later. We'll keep an eye on it, so stay tuned, and thanks for listening.